Welcome to this episode of Knowing Your Way, a Princess Margaret ovarian cancer podcast. I'm your host, Alicia Sarabia. I'm married to my husband, Paul. I have two children. One of them is Michael, who will be one of our guests, and the other is Caroline. I'm a physician, and I've been living with ovarian cancer for 6 years now. This podcast is a resource for women, family, and friends who are living with ovarian cancer. The Princess Margaret Gynae Oncology team and I want to assure you, the listener, whether you're a patient with ovarian cancer or if you know someone that is, that you're not alone. The reason we put this podcast together is to emphasize this point with you, to let you know that that we are a resource that is here for you so that you never feel alone. In my experience, the worst thing about having cancer is bearing witness to the suffering of those that I love as I go through this journey. And in fact, one of the most difficult things that I've ever had to do was to share the new diagnosis of ovarian cancer, particularly with my husband and with my children. Just talking about it now makes me feel fairly emotional. I'm not sure what emotions are being roused in Mike and Paul, but it was a really difficult time. And so in discussion with the gynecology ovarian cancer team at Princess Margaret, we thought it would be really important that we devote a full episode to this topic itself. I don't think I've introduced Dr. Mary Elliott yet. Mary is a psychiatrist and mindfulness teacher at Princess Margaret, who's also quite involved with staff well-being at the hospital. Welcome, Mary. And thank you to all for participating today. So I'm just going to briefly talk about my personal experience and then allow Paul and Mike to share their personal experiences when they first heard the diagnosis, and we went on to share the diagnosis with others. I had no real symptoms prior to getting my ultrasound done, except for some swelling in my lower abdomen, which prompted this test to be ordered. And while I thought that I was going in with a simple case of fibroids that needed to be managed, I quickly realized that the diagnosis was much more serious, that I likely had ovarian cancer. And in fact, this went on to be confirmed. My husband was away at the time. He had spent a lot of time on the road, so to speak, with his work. And so we had a telephone conversation that night where I told him what had been found on the ultrasound and what my fear was. I have to say that I don't remember a lot about that conversation, and I don't remember a lot about the conversations that we had with our children. But I believe that in part, I was very kind of matter of fact about what had been found and what the action plans would be. And I think that I was that way because that's the way I function at work. You know, I'm faced with the problem, I define it, and then I lay out what needs to be done in order to solve the problem or manage it at least. On the other hand, I do remember being very, very tearful. Sometimes I spent a lot of nights in those early days crying a lot with either my husband, who eventually had come home from work, or with one of my brothers who had stayed with me during those days when Paul was gone. I had my kids at school, and I know that in those initial weeks after I knew about the diagnosis, that we did spend a lot of time discussing how we would tell them the news. And but I don't remember the details, to be honest. So with that, I'm going to ask Paul to tell us a little bit about his initial reactions and the discussions we had about sharing news.
Well, these dates are remarkably so clear in my mind. I'm a sportscaster by trade. I work for the Toronto Maple Leafs. That was the last 25 years of a 41-year career. Numbers are what I do. Memories and time frame is what I do. So these moments, especially Alicia's initial diagnosis, remained so very clear. And we were in Dallas, myself, my colleagues, the Maple Leafs, about to play the Dallas Stars. It was November 8th, 2015. We're getting ready, having a pre-dinner drink the night before the game with my colleagues. And, you know, life's fun. I was a host for the Toronto Maple Leaf Hockey Club. I was traveling all over North America, and I'm just speaking from my own perspective. It was Camelot. We had 2 kids, both at school, both great kids. Life couldn't have been more perfect. And then all of a sudden, I'm looking at my phone, and it's a text from Alicia saying, "Can you call me ASAP?" And I'm going, oh, you know, well, hopefully everything's good with the kids. Never in my wildest dreams did I think there was a situation with Alicia. I just said to the gang, I've just got to go to my room just to make a phone call. I'll be right back, and we'll Uber over to the steakhouse in Dallas. And I phoned Alicia, and she just said, I think I might have ovarian cancer. And then all of a sudden, life changed upside down. And that jar that was, from my perspective, my career, my family, was turned upside down. That jar that had a nice little ribbon on it was turned upside down. And I just said, I'm coming home. I'm coming home. I was looking at flights out of Dallas that night, up to Detroit, up to Buffalo, up to New York. And then, and you said, Alicia, no, you're going to stay where you are. You're going to go do the game in Dallas. You're going to do the game in Nashville. I'll see you at the end of the week, because we're not going to look at each other in the living room and twiddle our thumbs and talk about what if. And that's what but I was a caged animal. It was emotionally, I'll never stay at the Marriott in Dallas ever again, if we're ever back there. It's just too much emotional scar tissue that just gets ripped up every time I think about it. And that, from my perspective, is what went on. But what I'll always remember was just how strong you were. And I don't know if it's you individually, whether it was your medical training, but you carried me by the bootstraps through a difficult time. And that gave me strength. But it's just one step toward another step to get to the other step. And that's from being diagnosed, from surgery, from chemo, each appointment after each appointment, and moving forward. You get stronger along the way, and you get knocked down along the way as well. And here we are 6+ years later, still talking about it. And then the other perspective is our kids. And that, to me, was the hardest. How do we let our children know in the best possible way? You're always protecting your kids. And I know Michael and I were at a sports event recently, and that's what I always remember. How do we break this to you in the best possible way? And that's it in a nutshell, going back 6+ years, and here we are still talking about it, and it hurts to talk about it. But our new normal has certainly changed from what the old normal once was.
Absolutely. Yeah. So thanks, Paul. And it is tough. Like, I'm a little bit teary right now, reliving those days. They were really difficult. But again, the purpose of this podcast is to see if we can help other families that are going through the same situation. Mike, do you want to add something to the conversation?
Yeah, for sure. First of all, I just want to thank you, Mom, for having me on this podcast, and Mary for organizing, and for everyone who's been a part of this. Again, thinking about this topic and talking about it is a difficult thing. And leading up to today, there was definitely some tightness in my chest and nerves that were caused by it, because it is something that I think about a lot. But it is, as my dad mentioned, there is some emotional scar tissue that gets sort of brought up when we do think about it. I guess thinking back on the diagnosis, I was at Queen's University. It was about 2 weeks before exams, and I was already a bit of a bundle of stress just naturally as a student. But I got a phone call from my dad just giving me the news. And it was really, it was sort of like a carpet had been swept out from under my feet. Very heavy. And I just left the library that I was at with my friends just to go home and just to process and to be with myself. But it's not something you can process quickly. I think from that point of the day I found out about it, it's almost like, again, I was moving through life, sort of waiting for different dates, waiting for my mom's test results, waiting for the coming surgery, and always sort of waiting and hoping for some progress. And of course it did come. I think during those times, what was really important for me was to be with my mom. I was away at school. And as a student, that was difficult. I'm very close to my mom and my dad.
Yeah.
And yeah, so it was important for me to be home with them. But at the same time, my parents wanted me to, be at school, enjoy my experience, and to not let this sort of divert from my natural path. But, time went on. We got through the different events, and my mom's been through so much, and she's been through recovery. She's been through remission. And I guess where I'm feeling now through all this is, gratitude, because this experience has caused a lot of pain, but it's also made me a stronger person. It's made me acknowledge how close I am with my mom. So for that, I'm grateful for that, for sure. But, I'm just thinking about another person my age, or any person who's a son of or a daughter of a mother or father who's sick. I think it's stressful because, right now things are good, but things might not always be good. So I was talking to my girlfriend the other day about that, like just sort of, how do I prep myself for potentially when things might not be good? And I think that's something that's hard, but I think it's important to do. And my mom talked me through that during these experiences too, just to look at things, with an open mindset, to be positive, but to also be, just to be, practical with thinking too, I guess. It's not an easy thing to talk about. And even just trying to talk about this, there's a lot of thoughts and a lot of emotions that come to me. Yeah. But it's sort of like an event in your life where it marks a beginning of something, like the end of something, and the beginning of a new part of your life. Mm-hmm. Life before, and now this is life after. And there will be, maybe in one's life, I'm only 25, I have lots of life to live. There are different events in one's life that are like that. But I know that this was one of them for sure. And it changed me as a young person moving into adulthood, big time.
Yeah. Thank you, Michael.
Welcome.
I know it's tough for you to talk about it. It's tough to listen to the people that you love going through this experience, because as we said, that's the hardest part of all of this. It's not what I'm going through or have been through. It's bearing witness to the suffering that others around you are going through. So Mary has heard many stories in the past. I'm sure every family is different. Not every family is like ours, but there've got to be some common emotions that everyone goes through, regardless of the dynamic within the family.
Yeah. And, I think that, first of all, just I am witnessing a family that's so cohesive and able to talk about these things, which really gives you a leg up. And also the hope that you bring to other families by talking about just how challenging this was, and how now, like Michael was saying, like there's this BC and AC, before cancer and after cancer, and how he's reframed this as not just an after cancer, but a new beginning. What the post-traumatic growth really that's come out of this through the deepening of the relationships within the family. That is the optimal outcome that we would really be aiming for. And yet it can be a challenge to get there. a few comments is just as we were talking in a previous podcast about the range of ways people experience the new diagnosis and the range of ways for which people cope. Even within a family, sometimes what we often see is people have different ways of coping. And under this extreme stress, we go to our coping mechanisms that have worked for us, but sometimes they don't fit very well with our partner or with our family members' ways of coping. Yeah. So often we see one family member, often the person with cancer, in the case of ovarian cancer, the woman who feels very emotional, and sometimes we see their partner shutting down, and that can add a real layer of added distress, because it can make someone feel angry, unheard, in that disconnection. And yet, sometimes it's just too overwhelming for the partner if they're not used to processing emotions. Paul, you seem like you were really in touch with your emotions. Oh. And so I don't want to just make this a gender thing, but it's just about ways of coping. And so really acknowledging that family members may have different ways of coping and different rates of coping, I think is so important. Like sometimes people's children may look like they don't care because they're going off to process this outside of the family with their peers. Sometimes not. Sometimes they become quite isolated because their peers have never experienced anything so monumental as this. Mm-hmm. So one of the strategies is to see, oh, we cope differently, and to name it and to talk about it and to see if that can sort of start to, where is there common ground? Where can we name what we each need? If we really don't feel like we can be providing for our partner or our parent to be able to say, I wish I could do this for you. I desperately want to make you better. I want to make this cancer go away. But can we reach out to this friend or that friend? Or can we reach out for professional help from a therapist or social worker or psychiatrist? I don't know how you all respond to that, but yeah. And I've seen it, I've seen it with siblings. Like I've seen one sibling want to like leave school and go home, back home from university, and the other one saying, oh no, I'm going to go home and see mom, but I'm going to get back to school as quickly as possible. And then the parent can feel a little like uncared for or unloved. And I'm like, well, why do you think they're doing that? Well, that's where their peer group is. That's where their support system is that they need at that time, which is in universities so age appropriate as well. There's no right or wrong. It's just two different styles. And again, talking about those different styles can glue us together rather than disconnect us.
It's interesting.
How do you respond?
Yeah, it's in that I get lost in certain ways. I was saying to Alicia, since 2015, there's not 10 minutes in the day where I don't think about Alicia, the kids, myself, in a situation that surrounds us. But every day you get a little stronger. Some other days you get knocked back. We have a place up near Collingwood. There's a hill up there that I like to climb on my own or together, but often on my own because the stress of getting up that hill, timing myself, trying to better that previous time. Those are all times that I can forget about the situation. My son and I, we're at a recent football game. That was 4 hours of consecutive bliss. We had so much fun. And I don't think for once, with exception of one time where we talked about Mike's mom, my wife, Alicia, that we were just enjoying the moment. And it was such relief. Alicia gets a little frustrated with me. I know I'm on my phone on Twitter and social media, but it just dawned on me while we're talking here. That's an outlet for me. It's just an outlet. It's a release. Michael's got his. He likes, I'm going to let him speak for himself, but we all have releases, and we need those releases because it's 24/7. It's like I said, every 10 minutes, I'm thinking about our situation. But here we are. The kids have graduated with multiple degrees. I'm so proud of them. And again, it comes back to Alicia and the strength she has shown and led us through this difficult time. And we continue to move on. But I think these stress releases that you've talked about, they're absolutely vital. So,
and different ways of coping. And you referred to even siblings in the same family having different ways of coping. And absolutely, that was the case in our family. Mike can, Mike feels more comfortable, perhaps, generally speaking, sharing his emotions. And our daughter is more private. And initially, didn't share as much of her emotional internal self, her fears, as Mike did, and that concerned me, and it concerned Paul, and we shared the concern with Caroline because we weren't sure. I mean, this kind of talk is outside of my comfort zone. We didn't know how to manage this, and perhaps we should have reached out for professional support at the time. But I realized that over time, Caroline has, I think, processed this whole event in her way, and I'm not going to share the details because it's private. But we're feeling more comfortable now with how she processed it in her way. Michael, I'm sorry, I don't want to.
No, I was going to add comment to that as well. And I found it interesting too, just as an experience growing with Caroline as well. Like it was an opportunity where I did learn about some of our differences for good reasons, for all positive reasons, just learning about each other. But I remember being like younger, it was when I was 19, it was the first diagnosis. But I remember like within me feeling a little bit of unhappiness with Caroline. Like I wasn't happy with how she was dealing with this. I thought she should have been handling it more like I was handling it. Like I had this need to be next to my mom in bed when she was feeling better. I had to be holding her hand, or to have it was like I had to be connected with her at all. But that's just the type of person I am. Like that's me with my grandmothers. That's me with my friends. Like it's always been who I was. But now looking back on it, there was nothing wrong with how my sister is handling her situation. Like you said, she was just coping in her own way, processing things in her own way. And now as a 25-year-old, I understand that. And also just my relationship with my sister, we definitely know each other better and we accept our differences more. But it's just an interesting thing too, for people to understand too, that be patient with each other and your family members when going through these things. And if someone does something, that you think, they should be treating them better, they should spend more time, like keep it to yourself and be patient, because everyone's feeling this trauma in their own way. And I'm glad you just brought that up, because it's a good reminder for myself and for anybody just to be compassionate with everyone, because what people are reflecting outwards isn't necessarily what they're feeling inwards.
Right.
But it's a really good point. Yeah.
Yeah. And, we can be checking in with those people to make sure they're not feeling too isolated, that it's not about being so highly distressed that they can't be there. So just sort of distinguishing, is this their way of coping? Do they need some space? Are they receiving what they need from their peers and from those sorts of supports? The interesting thing, Paul, so I think siblings are so interesting, the whole way the family is coping, and just remembering when we feel anger or frustration or that shooting on people, often there's a softer emotion behind it. Like, Michael, you were worried about your sister. Like, what's going on here? You know, aside from the, I wish she was behaving differently, might have been, is she okay? Right? So that worry or concern, and behind that is like just wanting her as an ally in this. And
Exactly.
so that was your unmet need in that moment, is I need an ally, you know, because maybe my peers don't understand what it's like to have a mom who's received this diagnosis and what it feels like to be going through this. So, you know, remembering that. And Paul, I was thinking when you were speaking about my colleagues, some of my colleagues at Princess Margaret, led by Dr. Roden, and actually a colleague who's now in Israel, Michelle Brunn, did a study on psychological distress, in particular depression, amongst partners of people with cancer. And they actually found a higher level of depression amongst the spouses than the people with cancer. And of course, there's so many reasons for that. You've got your own emotional processing that needs to happen. And yet that can get squashed down because you're so worried about your partner. And maybe you don't feel like you deserve your reaction because it should be about them. So there's the shoulding that can happen. And then there's some extra roles you take on, you know, trying to pick up different jobs around the house, or, you know, now you're going to appointments. Like, not that you're complaining about that, but it is extra work. It's extra burden. So a buffer for that, of course, is a marriage where there's good attunement to begin with. But it's nonetheless, it's still there. So that's so fascinating, right? To think about, because we often, that goes unrecognized, that whole piece around the spouse and their distress.
Well, I think it often does, but when it does come up, you know, even Paul describing his experience and saying, Alicia led us through this, or led me through it, or her strength. Every time Paul has said that in the past, including this time.
Well, you have.
Yeah, you know, I don't see it that way. I see it as all of us moving through this in our own ways. And I don't feel like I was responsible for moving us through. I really deeply believe that Caroline, Michael, and Paul, and my extended family on both sides, our friends, all of those people led us through. It wasn't a one-sided thing by any means. And so I try to, well, I always acknowledge it when Paul raises this, that I feel like you still don't believe me, you know? And
well, it's a team effort, but
Yeah.
in every team there's leadership, and you've been the leadership on this team without doubt. We've all played leadership roles, but it stems from you, and everybody's going to be different. I just know our experience. You've had to deal with, you know, your family, your mom, who's very emotional, and as she should be, especially with something like this. Your brothers, how supportive they've all been. My sisters, everyone. It's been a team effort. But again, I'll walk out the door. I'll head to the gym today. I'll be thinking about it, but forgetting about it momentarily, but knowing that we've got to proceed on. And the other thing, Mary, and I know, Mike, you know this, it's that checkup every 2 to 3 months.
yeah,
That's always looming. And when your work comes back and it's good and everything's within relatively normal boundaries, we get to breathe again for a little while.
yeah.
And that's a process that continues to be a process, and that never changes. I remember your first one after finishing up chemotherapy, and you were going, no, the numbers are going to be good, but And you didn't call us. You were at work and you didn't call us and I was so upset with you.
Yeah.
Like, I mean, your mother was waiting. I was waiting. I know the kids were waiting.
Yeah.
But
Yeah.
again, you've handled it with calm. That's helped steady the ship for us. And yes, it's teamwork. There's lots of leadership here, but you're in the head leadership role. Again, that's the way I see it.
Sure.
And I think that maybe it's just in this situation, but maybe it's Alicia's place as the mother, the matriarch. And a beautiful thing about your family seeing you as the leader is that kept you in one of your valued roles.
Yeah.
And when we hang on to our roles, when we don't prematurely let go of those roles which we value, motherhood, that part of our self-concept, being a wife, being the organizer in the family, just different roles like that really goes a long way to help us coping, because we haven't had that sense of self, that big piece of ourselves taken away from us. So often I'm working with people to help them reclaim roles that they've either given up or that people have taken over for them. And there's moments, of course, where we may not be able to perform all our roles, but even to psychologically stay in the driver's seat as mother, as, like saying to Michael, I know you want to come home, love, but it's really important to me that I don't take away your education from you. The cancer doesn't take away the education, not you, but the cancer. It's so important to me, if you can do it, to stay there, finish the year, and then we'll be together. So that's being the mom, right? And sort of, sending out that message, even though maybe you couldn't, zip off to, I think you said you were at Queens and maybe you couldn't go cook for him or something like that at that moment, but psychologically you were the mother and in that role. I don't know what you think about that, Michael.
Yeah, it was difficult seeing my mom ill, like and in bed. It was tough seeing her there because she's a strong, very like physically strong, mentally strong person. I always just sort of had that idea of her, so it was difficult to see her in pain, or like even harder to see her sad. Like that's the hardest thing. And when I was gone at school, one emotion that I dealt with a lot was a lot of guilt, because I felt like I'm here right now. As I'm here, my mother is 3 hours east or west, pardon me. And she's probably in bed. She's probably not feeling well. So I felt this sort of like instinctive need to be with her. And I did go home a lot. I did spend a lot of time with her.
Yeah.
So perhaps I felt maybe like a role for me was to take care of her. And it was funny, there was a children's book my mom and dad read for me growing up, but it's so funny. I teach kindergarten, and it was in one of the kindergarten classrooms that I teach. But it's about a mother raising the son as a baby, and then getting older, and the baby growing up, and then the son taking care of the mother. And I thought about that story as throughout the cancer, especially when I was going home to help her out. I'm sort of like, that was what I had to do. So.
Yeah. That's, I can't, every time I've read that book.
We still like,
love you forever.
Yeah.
But it was tricky because I felt like I had my role as a student. I had my role with my buddies. Like there are different dynamics going on as a 20-year-old or whatever. But also the raw, like the need to be with my mom, and just to be there for her. It's almost like something I couldn't escape from. And as a result of that, it caused me a lot of weight to carry when I was away from her.
Yeah. And I like how, you were able to say, I got to be there some of the time, right? And so it's
Yeah.
great, especially if people have the resources to be able to sort of come home for a bit and then go
Yeah.
back to school.
And I had the ability to do that. So
And you weren't too far away. And yet I just also want to highlight how it seems like it's also that contrast between the different roles, right? Like one, you're future oriented in developing your career, and you're working on your future, and you're worried about your mother's future, and that's a contrast. Then you also have the, I was going to say your teammates. I'm thinking of your father, your peers, right?
Yeah.
And like, let's celebrate, let's party, I'm not saying you're a partier, but I'm just saying, like, that people want to have fun or go out and do sports.
Exactly. Part of
and
it.
so it's a real mind game to shift like those emotional frames. And I hats off to you to be able to do that and to I think labeling it. And your mother is someone who's, I've learned, big on joy. So being, like, able to say, no, it's okay, go have fun with your friends. That gives me pleasure to know that you can still have a good time. Or in fact, some young adults tell me it's like, and teenagers tell me, like, they feel like the burden of needing to do well in school, or needing to do, look like they're having fun so that their parents don't worry about them. But that's another kettle of fish.
Yeah, for sure. Oftentimes my parents would call and I would just say, no, things are going awesome. They're going great. I mean, they might not have been going very poorly, but I know a lot of the times when I was at Queen's, I did spend a lot of time just on my own in my room. I just didn't have a ton of social energy, mental energy to do a lot. And definitely due to the trauma sort of from this experience it was tiresome, like burdening, and being away from it, from my family particularly. And my dad felt, he was working, he was on the road, so just as hard, right? It's not easy for sure.
Yeah. And knowing what resources are there for you, whether it's through Queen's, and it makes me think, did you find your way to, you don't have to
No, I'm totally
answer this if you don't want to, but were there resources that were helpful to you?
Yeah, like at Queen's,
outside of your wonderful family, which
absolutely. There were resources, and I did speak with one or two therapists at Queen's when I was going through this. But I will say that, like, at the time, I was a lot less mindful of my emotions and how I process things compared to I am now. So, it's easy for me to make sense of those experiences as a 25-year-old, because as a 20-year-old, a lot of the time I was just feeling the emotions rather than, I was experiencing them rather than just identifying them and being able to move with them. We still have every 2 or 3 months, my mom has a checkup, an appointment, and I still have that same fear leading up to that same anxiety, but the difference is now I'm able to breathe through it.
Right.
Whereas before, literally speaking, I would hold my breath.
Yeah. And so I was actually saying in a previous podcast that those sorts of events trigger us into survival mode, right? Yeah. And when we're in survival mode, you probably know this, that we trigger out of our window of tolerance into hyperarousal or hypoarousal. And in those times, like you say, we can't be mindful or reflective or integrate our emotions and problem solve, because literally that connection to the prefrontal cortex of the brain gets shut down, right? We're just fight, flight, freeze, try for attachment or fold. So it seems like from whatever mechanism you learned to recognize that, and you learned that breathing brought you back into that optimal place where you could say, this sucks. Like, this is really hard waiting for mom's scan results.
Yeah.
And yet, what can I do to help myself? Amazing that you came to that.
And at the time, I wasn't as into meditation, or into my yoga practice. The gym was a huge thing, like just staying as active as I could. I found myself in the weight room for like quite a long time, quite long periods of time. And probably that was huge for me. So if I were to mention a coping strategy at that time, that was a big thing for me, just to like keep moving, get in the weight room, do something that gives me a sense of sort of progress. Because at the time progress is something you want, wherever you can find it. I think so. Yeah.
It's such a healthy coping strategy and such a great outlet for anxiety and sadness too.
Yeah,
like it's a really good way.
I just to share that, 6 years in, I recently visited a therapist, in just how much of a relief it was to sit down for an hour and to talk to someone I'd never met before, to share my feelings beyond my conversations with Alicia and the kids. It was a wonderful experience. It was that the endorphin kicking in as you would have with a cup of coffee or finishing a jog or a good exercise. I had that feeling coming out, and I'm looking forward to going back and conversing yet more. But just being able to talk with someone, obviously, who was a professional and certainly could tap into the various aspects of my emotions, psyche, all of what goes with it. I couldn't recommend that more than enough. And it was a wonderful experience. And again, first time for me, and 6 years in that I went to do that, maybe a few years too late, but better late than never.
Never too late. And now, hopefully through podcasts like this, people recognize both as the person who has cancer and to their loved ones, their partners, spouses, family members, that it can be really helpful to use those professional resources. You articulated it so well, like someone who cares, right? And they want you to feel better, but isn't personally connected to the situation. So you can say anything and it's confidential, and you can really process in that way. Thank you for being so candid about that. Both of you, all of you.
Mary, for those people that are listening, then, if they feel that they could use that kind of help, I mean, would the logical place to start be with their family doctor, to ask them if they themselves could help them out, or if they know of a professional that could help them?
So it really depends on where their cancer care is situated. If you're at a major cancer center, often there are now family programs. Princess Margaret, thanks to the foundation, got a donation to fund what they call a caregivers program. I wish we had a different name than caregiver. I like to empower everybody and give everybody efficacy, and I don't want people to feel like because they have cancer, they're being cared for, but they are being loved and cared for. So it is a caregivers program. Just my own little rant there. I don't have a better name for it. So if any of your listeners have a better name, great. But that exists. We have social workers are usually trained in couples and family work. And so that's usually available. If someone doesn't have access to that, the family physician's great place to start, or nurse practitioners within family units for sure. And a lot of family units have that kind of help as well.
Right.
I know it's backtracking a bit, but if it's okay, I just wanted to come back to the decision to, I'm just thinking about families disclosing this, couples disclosing, or the person with cancer disclosing to their kids they have cancer. And I just wanted to, I'm not sure what your experience of deciding when and how to tell your kids came up. I think for some people, they first need to find their own legs so they're not too flooded or too distressed. And I'm thinking particularly if they have younger children. that might be the case. And also sometimes having a roadmap, knowing, like when you say you have a diagnosis, saying, and these are the steps we're going to take to treat this, can be really helpful.
Right.
You know, you had university age kids, so it's a
Right. And Mary, what about the timing?
Mhm.
Is that also just, I guess we need to think about what the timing is for each circumstance, but what should we consider when we're thinking about the timing?
did you have any, like, you all are experts and
No.
Well, your mother knew, your three brothers knew, and the big worry was that somehow, somewhere, the kids would find out through another source, and we didn't want
Exactly.
that to
It's
happen.
true, right.
Caroline was doing her undergrad at Western. She was coming home that weekend. She knew something was up. I was getting ready to go down to do our Maple Leaf pregame show on the Saturday, and you came in and just said, Caroline knows something's up. We've got to talk to her. And we
Yeah.
went down and told her, and then was telling Michael, but shouldering, sort of mattressing the presentation as best we can to ease the burden on them. But I know for a fact, Caroline was probably on Google 8 minutes later looking up ovarian cancer and 5-year rates. And Michael, you know, I'm not going to speak for you. I'm going to let you do as such, but letting them know. And once we had let them know, that was an immense relief. But
Right.
getting prepared for that presentation and trying to deliver the message properly, at least, is something I think everybody's got to go through on their own. And I don't know if there's a book way of doing it.
Yeah, there can't be. I guess not, you know.
Yeah.
And maybe that's the message. There is no one way.
There's no one way, there's no one time. But Michael, what are your thoughts about it?
Well, like I remember when my dad called me, and Dad, you did an amazing job. Like if there's one way to do it, you did it well, because you, like, it's impossible to hear that news easily. And I remember you were very confident in how you spoke to me. Like you were like Mom has stage 3 ovarian cancer, but you were stating she's healthy. Like you gave me some reassurance as well, that I knew that was illogical. Like, Mom, you were healthy at the time, you know, physically, you know, you don't smoke, you don't drink, like you're a healthy human. So that made me feel better. But I was also glad that I was told, like, I was glad I wasn't held off any longer. And I was glad my dad called me. And I figured it out right off the bat. Yeah, I don't know if I were a parent too, like if I were you, Dad, like, I don't know how I would call my son to tell him that.
It's very tough.
It's not easy. Yeah, for sure.
And those elements that you highlighted, Michael, are so important, right? Exactly. Like, this is the diagnosis. This is what we're going to do about it.
Yeah.
And probably your father said something like, you know, you can talk to us. You're not alone here. We're in this together as a family. Whatever words he would have used.
Exactly.
I'd like to add one other thing, though, that Paul alluded to, that we had held off a little bit in terms of telling our children, and our daughter, Caroline, she knew that something was up, you know, without us having said anything. So she obviously detected some change in the way we were just carrying on, and she knew. And so although it's difficult to come to that point where you disclose to your family, especially your children, they'll know that something big is happening. So it is better to give them the security that comes with knowing the truth, rather than to hide it from them and to have them live with this disturbance that's come into their lives for a reason they don't understand.
Exactly. So exactly, both you and Paul have highlighted two really crucial factors that help you in making the decision. One is that it's much better for your kids to hear it from you directly. Kids are sensitive. At every age, they're sensitive. Younger kids suddenly are getting babysat a lot, or suddenly be given treats or bedtimes that they're not used to having. So by you know, and it obviously at each, you know, there is no one way, there's no set book. There are some general guidances, but when you know, and depending on the age, clarity is really good. Younger kids need just age appropriate language and not ambiguity, not prognosis, not numbers, not statistics. It's just like, mom's got this, she's getting this treatment, her hair may fall out, you know, what do you want to do?
Yeah.
To, you know, help mom pick a wig or a hat or whatever. So there's lots that could be said about that, but so it's got to happen in obviously an age appropriate way, and what works for the family, and at a time when the parents aren't so emotionally flooded that it's scary to the kids, and on the other hand, that they're not kind of hearing it from the neighbors or something like that. That would be quite hard, or the school teacher.
Right. Great. So listen, we've been talking for quite a while now. It's been a very moving podcast for me, and I know for my family. And I know my daughter Caroline will be listening to this podcast, and I'd like to thank my family, my immediate family, for participating in this, and if not right here and now, at least listening and supporting. And Mary, I'd like to thank you as well for offering such great insight, which I really strongly believe will help families get through this really tough time. And so with that, we'll bring the podcast to a close. Thank you very much.
Thank you. And thank you all for being willing to share with other families, because that's what's really going to help. Your stories, your encouragement, and seeing that you come together and been able to tackle this.
Thank you, Mary. It's an ongoing healing process, and this session was a part of that process.
That's right.
Your words have made me feel better, and it'll help everyone else too. So thank you so much.
I'll just conclude that any of you who are going through this unfortunate process, to keep moving on and to remember, you're not alone. You're not alone.
All right. Take care, everyone. Bye.